So this week you have mood disorders as one of your conditions that you're doing an in-depth understanding of. So when thinking about the impact of mood disorders on occupational performance, we really need to understand that mood disorders, particularly those at the extreme ends of the mood spectrum, can significantly interfere with daily functioning. Symptoms of both a mood disorder and bipolar disorder interfere with one's ability to work, socialize, participate in recreational activities, sleep, eat, learn, engage in basic activity, daily living skills, and IADLs. But the impact on occupational performance can vary greatly based on factors such as severity of symptoms, responsiveness to treatment, number of episodes, any other co-occurring conditions, and certainly the age of onset. So for example, an adult with a high level of premorbid functioning who experiences a single episode and responds well to intervention may successfully return to work and family roles. However, there are many individuals who might be on the opposite end of that spectrum where premorbid functioning might have been not quite as high. Maybe they have multiple episodes and are not responding well to treatments or interventions, and they have a much more difficult time successfully returning to their previous roles, routines, engagement in work and family. So we really need to consider the numerous barriers to occupational performance that might occur once symptoms have manifested. But specifically thinking about activities of daily living, the ability to care for one's body in areas of hygiene, toileting, and sexual activity could be impaired. Previously maintained daily routines can be disrupted. Symptoms of avolition and anhedonia seen in depressive episodes can decrease motivation for exercise, proper nutrition, grooming, and hygiene. Symptoms of distractibility, impulsivity, and psychomotor disturbances that are characteristic of a manic or hypomanic episode can interfere with the quality of self-care. Sexual activity might be heightened during hypomania and manic states and lowered during depressive episodes. And many medications that are used to treat mood disorders specifically now, but also other mental health conditions, can also result in decreased sexual drive and or performance. And you might see our clients less willing to take these medications because of some of those side effects, sexual activity side effects or cognitive side effects. So just keeping that in the back of your mind. In terms of IADLs, early onset in childhood or adolescence, a time of developing skills and interests, IADL interests, coupled with high rates of reoccurrence through adulthood, can limit one's ability to develop financial management, home management, shopping, parenting, and safety skills. For individuals who continue to experience residual symptoms between episodes, it can be even more difficult to maintain consistent IADL routines. The individual dealing with reoccurring depressed, manic, or cycling moods has maybe a greater difficulty managing these daily tasks that support home and community life. So as the OT, thinking how we can create interventions to support our clients being able to engage in those IADL tasks. In terms of health management, individuals may have difficulty communicating with and following recommendations of healthcare professionals. So thinking back to medications and medication management. Executive dysfunctioning can result in decreased organization, time management, planning, and problem-solving skills necessary for getting to medical appointments and taking medications prescribed. Another side effect of some of these mood medications to treat mood disorders, it can cause increased hunger, resulting in weight gain and difficulty maintaining a healthy diet. Think about those comorbid, or not comorbid, but having the overlaying feeding eating disorder with a mood disorder, and then the medications and how that can increased hunger, and if somebody has a feeding or eating disorder, how those two together can be, what a volatile situation that can be. Symptom management, such as emotional regulation and stress management, can be impaired and are necessary to develop and maintain healthy routines. So, this is a huge area that OT can address. Think about rest and sleep. Sleep patterns are often disturbed, with individuals not getting adequate sleep, maybe sleeping excessively, or experiencing poor sleep quality. Education, work, adults and children and adolescents with a mood disorder may experience symptoms that negatively impact school performance and ability to engage in educational and work training. So how do we support those clients who maybe are not able to stay enrolled in school because of depressive episodes, or able to function in the workplace because of maybe depressive or manic episodes? And the same with play and leisure and social participation. Involvement in healthy leisure activities can be limited. With the manic depressive episodes, there might be social isolation, and they might cease participation in activities due to symptoms of anhedonia and avolition. And then maybe during a manic or hypomanic episode, they might experience initial bursts of creative goal-oriented energy, but then maybe that energy transitions into risky or dangerous activities, and then maybe termination of the activities. And the individual's support systems and their networks might be very small, so it might be difficult for them to maintain meaningful and productive roles and to experience a greater quality of life through social participation or play and leisure. So really thinking how all of these areas of occupational performance are impacted for our clients, and then how that might be an underlying disorder on top of a new condition, stroke, brain injury, hip replacement, Alzheimer's, whatever it is. So don't hesitate to reach out with any questions, and I will talk to you soon.